Hey, period party people. I am so excited to be with you this week. In this episode, I am joined by Dr. Becky Campbell. She's affectionately known as the Histamine Queen, and she's a renowned expert in histamine intolerance, gut health, mast cell activation syndrome, and mold illness. Dr. Campbell shares her journey and how she became a leading specialist in these interconnected health issues. And we dive into the intricacies of histamine intolerance, exploring how it manifests in the body, and its reciprocal relationship with gut health. Becky shares the complexities of mast cell activation syndrome, distinguishing it from histamine intolerance and discussing its impact on women's health conditions such as endometriosis and PMDD. We examine common symptoms and triggers of histamine intolerance and mold illness, offering insights into how individuals can identify and manage these conditions. She also provides practical advice on mitigating mold exposure, diagnostic processes for histamine intolerance, and related illnesses, and effective treatment approaches, including dietary and lifestyle changes. This episode is packed with valuable information for anyone seeking to understand and manage these often overlooked health issues. I hope you enjoy this episode. Becky, finally, you're here with me on the podcast. Thank you so much for
I
being
know it's
here.
only been a couple years.
I know. I know we've done a lot of back and forth, but we made it happen. And I'm so pumped for
Yeah,
this conversation.
me too. I'm
Yeah,
so excited.
I know. Thank you. Thank you for taking the time amidst all of your home renovations and mold and all these things that you're going through. I know that it's a lot, and we're going to talk about it.
Yeah, we
Yes.
we should because I feel like I have so much information to help other people figure out if they're going through this too, because it's a crazy journey. So we need
Yes.
guidance.
As I found out from you and various others. I thought we would just start with you talking a little bit about your background and what led you to become, I mean, I call you the histamine queen because I feel like that's what you are, specializing in histamine intolerance and gut health and mast cell activation syndrome, mold illness. I'd love to hear a little bit about your background.
Yeah, so I can say like even from childhood, I've never felt what I would consider normal. I mean, I felt okay, but I noticed like weird things that now looking back, I'm like, oh, that was my mast cells, or that was my histamine acting up. So I got migraines. I was more tired, I felt like, than other kids. I got hives sometimes, just kind of weird stuff. And then when I was in college under an enormous amount of stress, it really started to affect me. I gained 30 pounds kind of out of nowhere, which I'd always been just kind of an average weight, and I was not doing anything. I wasn't working out less or doing anything that would bring that on. I wasn't eating any different. I was losing handfuls of hair. I had ridiculous brain fog and I was trying to go through school, so it was very hard to focus and to kind of get through and learn everything I needed to learn. So, I went to different doctors, and of course, everyone was like, oh, you're fine. Like your blood work's fine, which was barely anything that they tested anyway. Your gut's fine, you're this or that. So I finally found someone who at the time it wasn't really called functional medicine, but because this was, I don't know, 25 years ago or so. But it was like holistic medicine. So they had all these naturopathic doctors and health coaches, or they were nutritionists then doing what I do now. So long story short, they looked at me a lot more thoroughly and they found out that I had a thyroid issue, Hashimoto's. I had a lot of stuff going on with my gut. So I had yeast overgrowth, I had parasites, H. pylori, I had really high cortisol. I was sensitive to a lot of the foods I was eating. Now when I hear food sensitivity, I know it's probably a gut issue. But at the time, it was a big thing. It was like food sensitivities were all over the place. So anyway, I incorporated a lot of the stuff that they had me incorporate and I started to feel a lot better. But there was always kind of like still some nagging issues. And I noticed a lot of stuff when I would eat. I would feel really weird after certain foods. And I couldn't really pinpoint it because it was like all about fermented foods and avocados and all that stuff. And those are all foods are all really high in histamine. So I would eat those foods or drink a kombucha and which is full of, histamine. And I would feel so weird after. And I would get, bad headaches. I would get really tingly, like crawly type feelings on my scalp, bad brain fog. It was just weird. So then eventually I learned, and this is after I was already practicing, I learned about mast cell activation syndrome, learned that I had that, and then learned that I was very sensitive to histamine. I had trouble breaking down histamine. So that caused me to have histamine intolerance. So I can talk a lot about that because there's a lot of people think that you have to have both, and it's definitely you can have one or the other. So, but yeah, that's how I got into this. And then mold has kind of been my biggest trigger, making me the worst. What there's been a couple times I've been exposed to mold, and those were the times I was the sickest. So what I'm finding with all my patients now, if they're coming to me for mast cell activation syndrome or histamine intolerance, I'm like, most of them have an issue with mold.
Right.
So there's a lot of crossover with all this too.
Yeah, that's the big thing. It's the crossover. And I often hear from women, well, I have histamine intolerance. Like, what do I do? And I was like, I'm often saying to them, well, that's sort of just the tip of the iceberg, so to
It's
speak.
the
It's just,
symptom.
right? It's
Yeah,
just the
it's like,
symptom.
yeah,
Yeah.
exactly.
Yeah, that makes so much sense. And so, talk to me a little bit about the difference, right? The difference between histamine intolerance and mast cell activation syndrome, because, I think they're used interchangeably a lot of the
Yeah.
time, at least online, and they're obviously different things, but
Yeah.
the same, also the same.
Yeah. So mast cell activation syndrome is when you're pushing out too much histamine and other inflammatory chemicals besides histamine as an immune system response to something in the body. But that happens with everybody. But with mast cell activation syndrome, you're reacting to things that aren't necessarily a threat. So if you get too hot or you get too cold, your mast cells might start dumping all these chemicals, whereas someone else wouldn't do that. Or you smell perfume, you might start dumping all these chemicals where it's not technically like a virus or pathogen necessarily that the immune system needs to come into play. So you're basically dumping out more chemicals, histamine being one of them. That's the main thing with mast cell activation syndrome. But you don't have to have histamine intolerance because histamine's only one of the chemicals. So with mast cell activation syndrome, you can be fine with histamine because you're dumping out more other chemicals, or you can break histamine down well, so you're not building up too much histamine, versus something else. With histamine intolerance without mast cell activation syndrome, you just have trouble breaking histamine down. So it doesn't mean that you're necessarily pushing out too much histamine. It just means you are not breaking it down well. So, and then there's various reasons you can't break it down well. And so when you're addressing histamine intolerance, you're trying to fix that issue. You're trying to work on why are you not breaking it down well, which is why histamine intolerance can be temporary, whereas
Okay.
mast cell activation syndrome is not typically temporary, um, but it can be very well controlled. You can figure out what your triggers are and just stay pretty clear of them and feel really well also.
Right. Okay. That's super helpful. And then with histamine intolerance, can you talk about how it manifests in the body and are the symptoms different to mast cell activation syndrome?
So the symptoms tend to be very similar. It's really inflammation. So it's brain fog, it's skin issues. A lot of people have skin issues and they don't realize how tied to histamine that is. Um, like eczema, but flushing, all that stuff. You can have exercise intolerance. When we're exercising, we are releasing more histamine. So if you're not breaking that down well, you can have an intolerance to exercise. Where some people, it's just like, oh, I flush when I exercise more than the average person. And some people, it's like, I feel awful for days. So, I talk about exercise intolerance a lot because I know that people struggle with it and they have no idea where it's coming from. You can have vertigo, you can have insomnia because histamine really wakes up the brain. So it's kind of, especially like as we go through the day, we're building up more histamine. So when it's time to go to sleep, it's very hard to go to sleep for some people with histamine intolerance.
Makes
You
sense,
can have
right? With an like an antihistamine makes you drowsy, right? So yeah,
exactly.
yeah.
Yeah. Yep. Swelling, so congestion, because all of our, we're getting inflamed everywhere, right? So our ears can become itchy. We can get like running of our nose. Like a really good thing to look at is when you're eating, and this doesn't happen with everybody, but when you're eating something high in histamine, your nose tends to start running, or your ears might start to itch, or you might get congested. That's like a really good sign. It happens with a lot of people when they're drinking alcohol, they'll start flushing. So that's because of the histamine. So that histamine's getting in there at high levels, and then we're not breaking it down well. So it's
Right.
sticking around and it's causing these symptoms. Anxiety is really common. You can get something called dermatographia, where you can basically like draw on your skin and it kind of stays there. So a lot of swelling, a lot of redness, a lot of that kind of stuff, gut issues. We'll talk a little bit about histamine and estrogen in a minute, but they play off of each other. So you can get estrogen dominance linked to histamine intolerance and vice versa. Estrogen can cause us to release more histamine. And so it's this kind of vicious cycle. So those are some of the
Yeah.
more common symptoms that people see. There's a lot of symptoms, honestly, but you know, um, those are probably the most common that I work with.
And what about you mentioned hives earlier? Because that's been my
Mm-hmm.
thing. And
Mm-hmm.
so like hives and rashes and stuff too, right? It's a
Mm-hmm.
big one.
Yep.
Okay.
Anything with the skin, because we have a lot of mast cells in our skin. So
Right.
when we're pushing out those chemicals, they're real close to the skin. So they're going to cause that inflammation and they're going to cause the swelling and all that redness. So yeah,
Right.
a lot of skin issues.
Oh, yeah, the worst.
I know.
Yeah, I mean, it's crazy because I remember a client said to me years and years ago, she said something along the lines of, I thought they were just mosquito bites. And I was like, nope, pretty sure you're having hives, like a hive
Yeah.
reaction, because it was the dead
Yes.
of winter. So
Yeah.
she definitely
Yeah.
wasn't having bites from any insects. And
Yes.
we just don't even know. You don't even realize until, like you said, you start to put the pieces together.
Well, it's confusing. It's like, what is this? Why do I have symptoms all over the place, and no one knows what they are?
Yeah.
So,
I thought you said something really interesting when you were sharing your story because mine is very similar, except that it was the birth control pill that really did it for me, I feel like, when I was in college. But I was also pretty sick, not pretty sick as a kid, but I definitely had problems that my sister
mm-hmm.
just didn't have. And so I look back at it, a lot of it makes sense just when I think about the whole histamine, whether it's mast cell activation syndrome or not, I'm not sure. But
Yeah.
yeah, it makes a lot of sense to me. So I think that it's important for people to look back at childhood and see what was going on there, and then what's shown up symptom wise from what you just described.
Yeah, and a lot of it, you said your sister, like my sister has never had an issue.
Mine
She's
either. I'm just
so
like, I hate her.
normal.
Yes. And she's like, you're just a hypochondriac. I'm like, I'm not a
Yes.
hypochondriac, I swear.
It's true. And
So
and
annoying.
it's genetics. My sister runs like my dad and I'm like my mom. My mom has all the same stuff I do. So,
Yeah.
we share genetics obviously, but not every gene mutation affects you the same. You could have a gene snip and it doesn't mean it's going to do anything. So, there's so many factors to it.
So many factors, I know, which we'll get into. So, can we talk a little bit about the gut connection?
Mhm.
How does the gut influence histamine intolerance and vice versa? Can we start with that?
Yeah. So with any, if you're thinking about the gut, you're thinking about infections, right? Well, first of all, there's an enzyme that breaks histamine down called DAO. A lot of our DAO is made in the gut. So if we're eating high histamine food, that enzyme breaks down our histamine, the histamine in the food, and we should be okay. Well, when you have gut infections, and what I mean by that are like dysbiotic, but it's like a bacteria overgrowth or yeast overgrowth or parasites or H. pylori, that's an infection. So with any infection, your immune system's going to respond. And so when the immune system responds, we're going to release histamine from our mast cells. So that is going to cause not only us having a problem because that enzyme's not breaking it down, but then we're adding more histamine to the body. So we have it kind of coming from both sides there. So that's why the gut is one of the first places I look. I'm like, with every single patient, I check their gut health because a lot of the time you can get rid of histamine intolerance if you clean up the gut. Some people it's the only issue they have causing it, and some people it's not. Sometimes it's five things, but it just depends.
Yeah, always. I know it's so true. And so I really appreciate you saying that because I feel like that should be the first step in terms
Hmm.
of dealing with all of this is looking at the gut. So can you talk a little bit about the tests that you do generally for someone who comes to you who's dealing with these kinds of issues, gut
Yeah, and I'm going
wise?
to actually back up a little bit because the first thing I do is work on their detox pathways because many people, I would say almost all people with histamine issues do not detox well. I am guilty of that. I'm genetically a horrible detoxer. So
Same.
everything I take in that's not, that's toxic or a pathogen or whatever, my body doesn't want to get rid of it or doesn't know how. It doesn't have those pathways out. So then my mast cells are always trying to like kill that thing coming in, that pathogen. Um, so I always work on detox. Now, some people I can put on supplements for that, and some people are too sensitive for supplements. So we'll work on gentle detox like castor oil packs and dry brushing and infrared sauna, rebounding, whatever, what I give them a different mixture depending on the person. But that's where we start, that and a low histamine diet. So we want to take out the foods that are adding histamine to your body. So if you're already having trouble breaking down histamine, you don't want to add more histamine. So that's kind of where we start. And then while they're kind of getting that in place, I order a stool test and we order the Dutch test to look at the hormones. That's how I used to do it. And lately, I've been ordering also a mycotoxins test on almost everybody because I'm finding that almost everybody with this issue has some type of either past or current mold exposure.
Right.
So, anyway, we start with that. And priority is actually mold. So, because while working on mold, you are working on you're at one point you're eventually going to do some antimicrobials anyway, so you're going to be working in the gut kind of simultaneously. But if there's mold in the body, I'm not going to ignore that and just go right into the gut. I'm going to kind of work on, I have like a system obviously, but I'm trying to work on what's most important and what's actively affecting you right now the most.
Right.
And I know it's kind of hard, like I wish I could give more
No, it's
detail.
so I thought you did a great job of explaining that because I feel as though we sort of view again histamine intolerance or histamine problems as sort of this isolated thing, and it's obviously not that. At least that's the
Mm-mm.
feedback I continue to get from women in my community. And then they're really just sort of finding out for the first time that there are histamine is a player in women's health conditions like endometriosis and PMDD in particular. And
Yes.
and I keep saying to them, and I know we talked about this on your podcast, but I keep saying to them that you've actually got to dig a little bit deeper. It's not
Yeah.
just, oh, you can just go on a low histamine diet and take some of the DAO enzyme and call it a day. Like you actually need to look at what's driving the histamine to be high in the first place. And especially the women who have said to me, oh, well, I've always had PMDD from the time I was a teenager. And so that just again makes me think, okay, well, what was going on in your childhood and what have you been
Yeah.
exposed to and what infections do you have in your gut? And the mold, like you said too, that's such a big piece as well.
Yeah, like were you living in mold as a child? Were you given antibiotics at birth? Think of all the endocrine disruptors we're using. Of course you had it when you were younger for some people. So, yeah, and also the question I get probably the most, and when I post anything on Instagram, like especially if I post a non-low histamine meal, right? People are like, "How are you eating that?" I'm like, the whole point of what I'm doing is trying to teach you not to have to live like this. This is a tool. Like a low histamine diet is a tool to get you through what you need to get to the root, right? We need to figure out if you have mold and if you have a gut infection, yeah, we're going to eat low histamine while we work on that. But then once that's gone, you shouldn't have to always eat low histamine. That's at least the goal because high histamine foods are really healthy,
Yeah.
so.
I know. I love a good bone broth.
I know. And our
Right?
fermented foods, I mean, a charcuterie board, that's like my favorite thing ever. And it's all high histamine. So you better believe I was going to work to be able to eat that again.
No kidding. I know. It's so true. I couldn't agree more. I feel the same way. That's so funny because I agree. I hear that a lot. Like, what do you mean? I can come off of this low histamine diet? Like, yes, girl,
Yeah.
you can do that. That's
Yeah.
exactly what you can do. Um, Talk to me. We'll come back to the PMDD and all of that stuff because I do think that that's such a big thing for a lot of people in my community. But can you talk about, since we were talking about higher histamine foods, what are some of those foods, some of those specific foods, and the environmental factors that would trigger a histamine response or exacerbate symptoms?
Yeah. So what causes us to have a decreased ability to break histamine down is gut infections, like we talked about, and then even leaky gut, like just anything going on with the gut, really. And then there's even vitamin deficiencies like B6. It helps DAO break down histamine. Copper and vitamin C help produce DAO. So you got to look at that stuff. Irritable bowel disease. So any inflammation is going to be a problem. Different genetic mutations, those definitely play a role, like our DAO enzyme and the different enzymes. And then mold, EMF exposure, estrogen dominance, stress. Stress makes us release a lot of histamine. So it's a mixture of things that make us release more histamine and also things that cause us not to be able to break it down. So that's kind of what I'm always looking at. And another thing too that's really important is if someone comes to me and they're on sympathetic overdrive. Like their nervous system is just, they're in fight or flight all the time. I'm not going to be like, why don't you take these 10 supplements? That's not going to happen. We have to work on our mind body connection, and we have to work on dealing with trauma and stress and calming our nervous system down. So that actually is also one of the first things we do. We're like, let's learn to detox, let's take out some foods, and let's calm down our nervous system. Because when your nervous system is going through something like that, or if you have a bunch of trauma that you've stored in your body and you haven't, learned to address and gotten out of there, you're not going to be able to handle anything else. Like you're going to see supplements as a threat. So that's why, there's so much talk about the limbic system and all that. And I'm so on board with that. I think that that is so, so important as kind of like a first step along with learning to even to be able to detox. You know what I mean? Like even if you can't take supplements, you got to look at your limbic system. So
Right.
really, I guess more of a first step would be that, nervous system, limbic system, all that stuff, getting all that even just calmed down a little bit, doing some of these programs out there like the Gupta program or the Vital Sign. Now, there's different programs. So working with a trauma therapist, doing inner child work, whatever it is, whatever it is that works, or all of the above. For me, it was all of those.
Yeah.
But yeah, so getting everything to calm down so that you can actually tolerate the treatment you need is super important. And anyone that you work with that doesn't tell you that, I would not work with them because they're not, if they can't notice that you can't tolerate a supplement and that there might be a step before that, they might not be the right one for you. So that's just something kind of to look for.
Right. I think that's so, so helpful. And just thinking about what we consider to be a common histamine trigger, which is just springtime in the Northeast, for instance, or
Hmm.
pet dander or grass allergies, whatever. What do you think about all of those? I mean, is that all tied into the gut, or is that something completely separate?
It's it
Does it usually come together with all the symptoms you're describing?
No, I mean, I think that allergies are like your immune system is seeing something as an attack. Like, this is a big problem. I'm going to jump in and cause an IgE reaction. That's an allergy. This is not an IgE reaction. This is your body is not dealing with the histamine in there already, or the histamine being added to it properly and not being able to break it down fast enough to get rid of it. So it's a
Right.
little bit different, and allergies will come and go. And yes, you can do things like this that will help allergies. There are things you can take. You can calm your mast cells down to not be so responsive to things that you have an allergen to, or allergens. But no, an allergy is not the same thing. It's a different type of response.
Right. Okay. That's so helpful to hear too. I imagine, though, that taking precautions or at least even cleaning up gut health and
Oh,
working on
yeah.
any kind of mold exposure and all of those would potentially really help with springtime allergies or, seasonal allergies and things like that.
It does because it's all a bucket, right? So
Right.
we talk about that the bucket theory with different things. So let's say with histamine, you put gut infections, mold, vitamin deficiencies, hormone imbalance, and stress in a bucket, you're going to fill your bucket. Go smell a certain type of grass or pollen, you're going to have this explosive response. Well, if you can empty out that bucket, as much as you can, then you're going to respond better to that allergen. Even if it's something that triggers you, it's going to be a different level of response, you know?
Course. Yeah, for sure. I would imagine it'd be much more manageable, which makes
Hmm.
so much sense. You were talking about the testing that you do with your clients and or your patients, and I was thinking about a question I hear all the time, which is, "How do I test for this, Nicole? How do I test for histamine intolerance? What's the testing that a doctor can order for me?" They're always like, "Can I go to my regular primary care doctor?" I'm like,
No.
"Girl, your doctor won't even." Will like kick you out of his office for even saying the words histamine intolerance
Yeah.
because they don't know it or they don't recognize it or whatever. So I'm curious about
Mm-mm.
that, like what testing one would do outside of what you were just suggesting, or is that not even something you even would consider?
I wouldn't even waste your time
Okay.
because there is no histamine intolerance test. So just test it with food. If you're having symptoms and you are like, is this a histamine intolerance? Start eating high histamine foods. A couple of days, like eat fermented foods, whatever, avocado, strawberries, dried fruit, spinach, have the smoothie I used to have, banana, strawberry, spinach, and see if you get worse or just react, in general, or even get new symptoms. And then take high histamine foods out for like a week and see if you start to feel better. Now, you're not going to be like, oh my gosh, I'm completely normal, most likely, because you're still having those reasons there, right? The driving factors, but you'll notice a difference. So, that is a really good way. And it's the cheapest way. You don't
Yeah.
have to go pay for a test. You can do it at home. Just do that. And most people can figure out from there if they have histamine intolerance or not.
Thank you for saying that. I know that's what
Hmm.
I tell everyone, but they don't want to hear that.
I
So,
know it's weird. You'd
I
think
know.
you'd want to spend no money and test it with some good food.
Exactly. And I also say too that the testing doesn't really change the outcome, like what you actually have to do in
No.
order to overcome this or at least improve this.
Yeah, because even like people are like, well, how do I know if I have mast cell activation syndrome or histamine intolerance? The testing for mast cell activation syndrome is terrible. Like it's so fragile, and these markers only show up if you're in like an extreme reaction for a lot of them. So I've tested positive and negative for mast cell activation. Okay. So I don't count on that either. And honestly, you're going to treat it the same. You're, for the most part, you're going to do all the same things because it's the same triggers.
Yeah.
So you're going to try to figure out why you're either letting out more inflammatory chemicals or why you can't break them down. And, you can kind of tell from your history, like if it's something that has always been going on as long as you can remember, it's probably more mast cell activation syndrome. If it's like, I was fine and then I got food poisoning and now I have this, or, like a certain time of your life, like when I turned 33, I suddenly had an issue with histamine. It's probably hormonal and it's probably gut related. It could be environmental, but it doesn't mean it's permanent. So it doesn't mean that it's mast cell activation syndrome.
So helpful. I think it's just such a good clarification. And I was thinking, as we're talking about triggers, we should talk about mold illness. And I know in one of our conversations, you told me that you have one of those genetic variants that
Hmm.
predisposes you to mold illness. Can you talk a little bit about that and just what mold illness actually is? Because
Yeah,
most people don't believe me that
I
this is
know.
a thing as well.
So it's a huge thing. So mold, okay, there's mold spores. And that mold spores we breathe in and we can push back out. But mold, when mold gets indoors, and everyone, this is a popular question. Well, isn't everyone around mold? Yes, everyone is around mold. But if your indoor mold count is higher than your outdoor mold count, that's a problem. That means that mold has found its way in your house and it's living there. And when mold finds a nice, cozy little spot behind a wall in your house, it doesn't want other mold there or bacteria. So it's going to spit out toxic chemicals, which are mycotoxins. So those mycotoxins, which by the way are used in chemical warfare, like they're for real, they're really harmful. They get in past the lung into circulation and they are lipophilic. They love fat. So they get into our brain, they get into our liver, our vessels. They really affect our nervous system. And people get misdiagnosed often with things like Alzheimer's, dementia, MS, whatever it is, because they have the mold and they think it's something else. So it's very real and it can cause so many symptoms. I'll actually give you a mold quiz and we can
Okay.
link a mold quiz. So because there's so many symptoms, I'm not going to say every symptom, but I'll give some of the kind of ones that stick out that may seem different from something else. Um, but they can make you feel it can make you feel so bad that when I lived in mold, and this wasn't the first time. I know I've been exposed to mold as a kid because I remember smelling mold as a kid, like playing in basements and stuff. But I didn't really, it didn't affect me the way it did as an adult. So when I was an adult and I was living in mold, I didn't know what was wrong with me. I was already teaching functional medicine. I was practicing it. I did every test on myself. I did not do a mycotoxins test though. I was like, there's no way it's mold. I would smell it, right? There's no smell. I can smell mold from a mile away. Well, actually, no, mold doesn't smell all the time. If mold's behind a wall or under a flooring or hiding, it's not typically going to smell until it meets oxygen. So, and it's not even mycotoxins that smell. It's their other chemicals like aldehydes, VOCs, all the alcohols. That typically is the smell we're getting for mold. So it anyway, it hides and it's sneaky. So that's the problem with it. You don't know what it is. But when I was living in it, I woke up every day feeling like I drank a bottle of vodka the night before. I could barely walk out of the room. It was on coming up from the floor under the bed I was sleeping in. So that's why it was so bad.
Oh,
But I would be like bumping into walls, walking out to the living room. And then there was times where I couldn't even walk to the bathroom. I would stare at the where I knew the bathroom was, and I would just be hoping someone would come home soon so I could get to the bathroom. That's how bad it was for me. Enormous brain fog, confusion, memory loss. Um, I never had any type of allergy symptoms, which are what people typically associate with mold. I never had that. I didn't have congestion. I didn't have all that stuff. I had major nervous system. Was uncoordinated. I was, like I said, I thought I had MS. I thought that for sure I had MS. I went and had a brain scan. I did not have MS. And I'm like, what is this? I took my breast implants out. I'm like, okay, this has got to be breast implant illness. Nope, wasn't that. And then I finally found the mold and I was like, oh my gosh, as soon as I got out of it, I started getting my life back, and so anyway, it's one of the worst things I see. A histamine intolerance where you're just like you have a headache and your skin's bad and you can't eat certain foods. That does really suck, but it's not the same as when you're barely functioning. And that's the difference I see with mold versus, when mold's in the picture, it can really put you at that level. It doesn't always, because I just had mold again in this house, but it wasn't where I was sleeping. It's on the other side of the house. I was being exposed to it throughout the day, like at times, but not like living in it. Plus, I'm doing all these things for detox now. My body's in such a better place. My bucket is so much more empty. So I tolerate it a lot differently. So you can have it both scenarios. But
right.
it's basically where mold gets into the body and it causes severe inflammation and it causes a lot of symptoms. Do you want me to give a few symptoms?
Oh, yeah, definitely. I mean, you just
Okay.
described so much of what you're experiencing, but yeah,
Yeah.
if there's anything else, for sure.
There's a lot. So take the mold quiz, guys, because you're going to see it affects every system of the body, but some are brain fog, fatigue, memory loss, irritable bladder is really because those mycotoxins get in the bladder and they make you feel like you constantly have to pee. So you might think you have interstitial cystitis.
I've heard that
Um,
about kids too, about kids
mhm.
suddenly wetting the bed again, and that's the
Yes.
thing you should be checking, right?
Yep,
Yeah.
yep, definitely. And then there are allergy symptoms that some people have, like the dry eyes, itching, congestion. You can have lung symptoms too, so like trouble with breathing or wheezing. But again, I had none of that. I've never had any of that, regardless of how many times I've been in mold. So don't go, oh, I don't have that. I don't have mold. Gut issues because mold likes the lining of our gut and we can actually eat it too. Um, Something really big is sweet cravings because mold and yeast are in the same family. And where there's mold, there's typically yeast, right? So that's why when I work with people with mold, I always work on yeast. But both of those things make you crave sweets big time because that's how they're fed. So mold wants to grow in your body. So it wants to be fed sugar so that it continues to grow. So if you're having these sweet cravings and you're like, I stopped eating sugar and I was supposed to stop craving sugar, but I'm not, think about mold and yeast. And then it can even affect like people get myocarditis from mold. It can really affect our cardiovascular system. You can have irregular heartbeat. You can have low blood pressure, dysautonomias. I had POTS, really bad from mold. Sensitivity to light. This is one that's really unique to mold and Lyme, but mold also, where you start noticing you're sensitive when you're looking at your phone, your computer, even outside. That's something what that really affected me. I had a really hard time looking at my computer, and I still do. It still bothers me. So any type of fungal infection, so skin fungal infections, vaginal fungal infections, and then, the nervous system stuff. So like anxiousness. And it's not that you're worried, it's like you feel that internal anxiousness and you don't know where it's coming from. It's like almost like an internal vibration. Incoordination, insomnia, tremors is really big. I had very bad tremors when I was living in mold. So, and then, some people will notice like they get sick and they stay sick for longer.
Right.
Um, I'm trying to think. So that's like the main stuff that kind of points away from something else.
Okay.
Um, but again, the it can affect you in so many ways. It's crazy.
I mean, those are a lot of symptoms
I
and
know.
they're so varied. And I think that that's one of the fundamental problems is that you have all of these seemingly unrelated symptoms. And of course, if you're going the conventional route, you're just never going to get the answers that you're looking for, which is so
Yeah.
challenging. And then you just go down this path of treating various symptoms and you're so much worse off. So, coming back to the diagnosis of something like this, I know you mentioned in the beginning you run a mycotoxin test. Uh, yeah, can you talk a little bit about that? Like, elaborate on the type of testing you're doing and if there's an additional test that you do. And do people need to like specially prepare for these tests? Because I've also heard that it doesn't necessarily show up on some tests. Uh,
Yeah.
and so you might have to do some stuff to prepare for them.
Yeah. So if we don't, the test I really like is a urine test, but if you don't push toxins out through your kidneys well, it might not show up or it might show up like a little bit. When I see it's a
Right.
little bit, I'm like, "Ooh, girl, you're bad. You just have no way of pushing that out. You really should be over here on that scale." So we might provoke it. Like I might have you use the sauna. That's actually how I got my first really big positive test was I used the sauna and it was like, I mean, it was bad.
Oh, wow.
So that sometimes glutathione, some people use, I found that glutathione can actually make it not show up on the test. So I do not use glutathione before. Um, but anyway, if I can get someone who detoxes fairly well, I always do blood work anyway. I'm looking at kidney function. And so a lot of the time we will just get a good positive on the urine test. But if not, there's other testing you can do. There's some blood tests you can do. Dr. Richie Shoemaker came out with a, protocol of testing, and I'll run his panel if I can't get a positive, any other way. But it's just not typically how I test for it. And then there's even now like a mycotoxin antibody test that you can do, and that's blood too. So it will show you like the type of mold you've been exposed to and what you're building antibodies to. It just doesn't really tell you like, are you living in it now? So, and even the urine test doesn't necessarily tell you that. But if it's really high, if the levels are really high, I assume you're probably living in it and it's not like just a past exposure. So then I will have you go to the next step, which should be testing your home. So with testing the home, I like to start with the ERMI test. It's like a dust test because where dust is like food for mold. So you can just there's different methods of how you can do it and you send it in and they'll kind of give you an overview of what they see. And then if that's, positive, which we look at the ERMI test with our patients, if it's positive, we will be like, you need an actual inspection, a real home inspection. Now, that being said, that's hard because some people are going to come in and they're just going to do an air sample and they're not comparing outside to inside air. They're not testing any surface samples. They're not really going around looking, which, by the way, I had all that done and the mold levels were not like alarmingly high. I had to basically knock a wall down almost on my own to find the mold here. My other place where I had it, that they did find that with an inspection. So with this, we had to knock down a wall. I knew was in this closet because I could smell it. And we knocked down the wall behind the closet and we saw mold all in the back of the wall. Um, and then I suspected it again where we had a refrigerator leak about a year ago, cleaned everything up right away. But if you don't, like it takes only 24 hours for mold to start. So what you really have to do if you have any sort of leak is you have to actually get in there and have them cut away some drywall and like make sure it hasn't seeped in and grown behind because with our kitchen it went behind the refrigerator into the wall and then into my son's closet, which was on the opposite wall. And we found it a year later. We just pulled up the carpet back there and it was all under the carpet. And we didn't know. You can't smell anything in there. So, anyway.
I mean, it feels, I'm sure that for anyone who's listening and thinking, oh my goodness, I might have this, it
Hmm.
probably feels very daunting. And so I just want to say to anyone listening, it's like a very step-by-step process, as you said, right? You start with a dust test or you start with a body test
Yes.
first, and then you progress. I'm in that phase, just so everyone knows. We did a dust test and it came back. I think I mentioned this to you when we were talking before recording, but it came back as pretty high for a number of
Yeah.
different molds, but there were no mycotoxins apparently in the test. I don't know what that necessarily means, if
Yeah.
that's a good thing or not, but ultimately there's lots of mold and we're in a high percentile in terms of houses that would have mold. So now like we'll move on to the more daunting step soon, but just not quite ready for that yet.
And the thing is you have to do it right with your insurance, So when I just did that closet, I had them go into the wall first and then tried to submit it to my insurance. And they're like, well, we don't, you demoed first. You can't do that. So then the second time I did not do that. I had a contractor and a mold remediator come over. They're the ones who lifted the carpet and found it. And I was like, okay, let's leave everything and I hired a private adjuster who is like representing me to the insurance company. And they told me the steps to take in what order so that the insurance company will cover it. So it can be covered by insurance. So just make sure you don't knock down any walls or do anything like that without first. I really highly recommend hiring a private adjuster because unfortunately we pay so much money for homeowners insurance and their job is to try not to pay for the things we have wrong. So anyway, that's where
Yeah,
I am with all this. But just
that's
so you
very
know, like it
helpful.
doesn't have to be this terrible thing. Like you can make it happen. You can deal with it. It can be okay. You got to work with a good remediator. So like we didn't leave the house. We couldn't leave the house. It's best if you can leave the house, but it was very contained to one side of the house. So they literally contained with plastic and covered wall to floor everything our air vents, we luckily have a second air conditioner over there. So we shut everything down on that side of the house. And we did leave a couple times, like a week, we would leave and then they would remediate. And then, so there is a way to do it safely. Um, getting good air purifiers is also important, but just know that that's not like a substitute for remediation. You have to get, just like with histamine in the gut and all that, you got to get to the source. You got to get the mold and you've got to get it out. And, so that's not really my area of expertise, the remediation, but I just like wanted to give people hope that it's not the funnest thing to do in the world, but it is doable and it's so worth it because you will feel much better if you're out of it and all this stuff will start to go away.
Thank you so much for this. I feel like I just learned so much. That pro tip with the insurance adjuster has just changed my life. I assumed that I was going to more than likely have to take on the cost of all of this,
Mhm.
but now that you're saying that, I have hope. That's good.
Yeah, and
Yes.
we'll talk more. I'll tell you
Yes.
exactly what to do because there
Okay,
is
thanks.
a system to it. So
Right. Yes. Don't be Becky, everyone, and knock down a wall on your own. That's the first step.
that claim was denied.
Yes, automatic denial.
Yeah.
Is there anything else that you would like to share with listeners with regard to everything you've just talked about? Like any other first steps or things to make this process a little bit easier if it feels overwhelming and daunting?
Yeah, I'd say whether you're dealing with mold or histamine or mast cell issues, you want to get the limbic system, nervous system, all that stuff in place, because that helps you deal with all of this better. And you want to get your detox pathways supported because that helps you push these issues like mold out better and not feel so bad. So those are the kind of the core things that I'm always working on and I always will. And I know I'm like, okay, these are like my little tools to keep me okay. Like no matter what comes up, as long as I'm working on this, I'm going to be okay. And then I'm always eating healthy too. I don't eat a low histamine diet anymore, but I eat low inflammatory. I eat real food, no processed chemicals, all that stuff, for the most part. And, as far as your home, make sure your humidity levels are checked. That was one thing. I had 66% humidity in this house. I had no idea. Um, and you can check these things. You can have someone come check it or you can check it yourself. Use air purifiers, use your vents, use your bathroom vent when you're taking a shower, use your kitchen vent when you're cooking. Because again, all that humid air, it's got to go somewhere. So like the one thing I see that can be a real nightmare is wallpapering your bathroom and then not venting it. And that it really likes, mold loves like drywall, wallpaper, paint, it loves stuff like that. And then, try to get rid of dust the best you can because it's going to be food for the mold. So those are my tips.
Thank you. So, so amazing. Wow. You've just blown my mind. Thank you. Thank you. I really appreciate it. Can you just talk about where everyone can find your work and all of your life-saving information?
Yeah. So my website is drbeckycampbell.com. And then on Instagram, I'm at Dr. Becky Campbell, Facebook, Dr. Becky Campbell, YouTube. It's all the same. I have books. This one's like my most popular book. And it's really, I tried to do this if you can't work with somebody. This is my 4-phase histamine reset plan. This is the one I would get if you're trying to do the histamine thing yourself and you want to do as much as you can by yourself, get that book. And then, I have tons of free articles about mold, mast cell, histamine, estrogen, all of that stuff, gut health on my website.
You do. You have an insane amount of resources. I actually have a friend going through your book right now in through that,
Aw.
yeah, reset. So, and she's loving it. So I feel like she also said she has hope for the first time. And she's also
Oh,
had PMDD since she was a teenager and is now finally put all the pieces together. So it's really cool to see that happening. So anyways,
good.
yeah.
Yeah.
Well, thank you again so much, Becky. I really appreciate your time.
Yeah. Thanks for having me.
That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest period party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at NicoleJardim.com/quiz.